Okay, let's review the muscles of the hip. So we have, first of all, let me take the muscles off because it's important to note that this is a true ball and socket joint from the head of the femur, how it articulates inside this acetabulum. And this acetabulum is made up of three bones that make up the coxa, or the side of the pelvis, the pubis bone, the ischium, and the ilium. All of those sort of merge together and form this acetabular fossa. So based on just the structure and design of this joint, you can see how we can have huge ranges of motion of the hip, more so than most other joints in the body, say for maybe the shoulder. So keeping that in mind, we know that when muscles are going to be recruited, they're going to have pretty profound actions. So let's add in our muscular system surrounding this hip. Good. And let me hide our abdominal wall. And that way we can reveal some of the items that we want to take a look at. So let's start with hip flexion. Now, hip flexion is going to mean that our knee is going to rise up. Okay, our knee is going to rise up in front of us. This angle of the hip is going to decrease in degrees, and that we know is called flexion. So we actually have two major hip flexors. The psoas is this muscle right here, and the psoas actually attaches to the anterior portions. See if I can zoom in here. The anterior portions of the lumbar vertebrae. So when we raise our leg using our psoas muscle, we're actually yanking upon our lumbar vertebrae when we do so. Now the psoas major and psoas minor, which is located right here, just actually inserts above major. Sometimes we actually don't even have a psoas minor. If you take a cadaver class, don't always expect this one to be there. But we always do have a psoas major. And the psoas major merges with the iliacus muscle, which is housed in the iliac fossa here of the ilium. And this merging forms the iliopsoas. Now this is where the iliopsoas attaches to the femur. Okay, just from a side view, posterior view, let's take an anterior look again. And you can see how these muscles, when recruited, when shortened, would raise the leg upwards. And that's exactly what happens. However, it is puny compared to this muscle, the rectus femoris. Now, the rectus femoris is special because it is one of the four quadriceps muscles, but it is the only of the four that crosses two joints. It crosses, of course, the knee because we know that the knee promotes knee extension, but it actually crosses the hip as well and is a major hip flexor. However, when the leg, the lower limb, is extended, okay, when we have our quadriceps recruited and the quadriceps are shortened, that means, go back to this right here, if I'm in this position, my quads are shortened already. And we have this rule with biarticular muscles, muscles that cross two joints, that if a muscle is already shortened at one joint, as it is in this case, at the knee, as the rectus femoris is, then that muscle cannot be a prime mover at the other joint, at the second joint. So when we raise our leg out straight in front of us, then the prime mover is the psoas muscle, and really the iliopsoas pairing of muscles. But if we have a flexed knee position and we are bringing or driving our knee upward, keeping that flexed knee position, say as we're running, then the rectus femoris ends up taking over as the prime mover in that action. Okay, so that's hip flexion. What else can we do with our hips? Well, we can extend our hips, and our gluteus maximus is our strongest muscle in the body, is a phenomenal hip extensor. So if we look at the motion of hip extension, we see this action right here. Notice that we also have our hamstrings, all of our hamstrings that are going to promote hip extension. So let's take a look at those hamstrings. All right, so if we remove, let's hide the gluteus maximus. Notice that the hamstrings attach right here on the bone that we sit on, called the ischium. Right on this ischial tuberosity. This is where our hamstrings attach. We'll fade the semitendinosus, and you can see that other hamstrings are attaching at this same point. All right, because they are attaching here and not on the femur, and we know that they are already crossing the knee down here, because we know that hamstrings promote knee flexion, we can say that our hamstrings are biarticular muscles, and they promote hip extension as well. So when we are running, for example, and we are pulling that leg back towards the ground very forcefully in order to maximize our stride length during a sprint, we are largely relying on the glutes, but we're also relying on the hamstrings to do that action. So the hamstring shouldn't just be thought of as a knee flexor, but also a hip extensor. And some people like to differentiate it, and they say the upper hamstrings and lower hamstrings. And it's not really true that it's upper and lower hamstrings, but because they are the same long muscles. However, they do have those two characteristics. All right, so what else does the gluteus maximus do? Well, let's take a look at this one. I don't want to cut it. I don't want to cut it. Okay, gluteus maximus. This muscle, being located where it is also going to be an external rotator, right? And it's going to cause us to abduct. So it's got a couple of roles here. It's going to promote this lateral rotation of the hip. So you can see we're rotating backwards or externally. And it will also promote hip abduction. That's drawing your leg out laterally in the frontal plane. Okay. So the gluteus maximus has several roles. If you have, say, tight glutes, what could you expect to happen? Maybe when you're squatting down, you could end up having a greater hip abduction or external rotation. External femoral rotation would show that the knees would actually be rotating outwards as you're squatting down if you have tight glutes. Okay, so that's your major hip extensor, among others. Next up, we have the adductors. Adductors. And the adduction motion looks like this. We are pulling back together. So we are abducted, and now we are drawing the leg back in this direction, medially towards the midline. Notice all of these adductors here. We have a number of these: adductor brevis, adductor magnus, adductor minimus, the gracilis down here, the pectineus up here as well. We're just going to call these the adductor group of muscles, as they form this nice really sheath of muscles on the inner thigh. All of them are attaching more medially than they are inserting, and so when they contract, they are pulling um, back to the midline. All right, if that's adduction, what is abduction? Well, let's take a look at this muscle. This is the tensor fascia lata. Tensor fascia lata. So it literally means it tenses a lot of fascia. The fascia that it's tensing is going to be called the IT band, that runs from the ilium to the tibia. Now, a lot of people get confused by this, and they think that because this is laterally located, this muscle is laterally located, it's not medially located, that it would attach to the fibula because that's the lateral leg bone, lower leg bone. In this case, it does not go to the fibula, it goes to the tibia. And oftentimes when this is um, tight or you have some impingement throughout or higher dense areas of the fascia as it connects to the fascia of the vastus lateralis, it could actually cause an internal rotation rather than an external rotation. Okay, so we can also see the sartorius in here, and of course the glute, as we said before, is an abductor, abductor as well. Okay, so we have flexion, extension, adduction, and abduction. Let's go into some rotation. So if we turn this around, we can see that we have a bunch of deep hip musculature in here. So we'll start off with the piriformis. Piriformis is among the largest of these deep posterior hip muscles that are living underneath the glute. So we take the glute off, this is what we reveal. And these are going to do lateral or external rotation. External rotation. So let's fade this glute, and we can see that all of these muscles together are attaching to the greater trochanter of the femur, and when they are contracted, they are rotating the femur externally. So if we take another look at this, a larger view, you can see that those muscles in the posterior compartment are contracting and rotating our femur exteriorly. So, led by the piriformis, but we also have a number of other muscles, including the glute maximus, but also the superior gemellus, the inferior gemellus, the obturator internus, quadratus femoris under here as well. All of these act as external rotators. Okay, so how about internal rotation? Let's go back up here, and we have the gluteus medius. Gluteus medius and gluteus minimus are going to be responsible for internal rotation, and also of note, as is the TFL, the tensor fasciae lata. And so we can understand now that because it does internal rotation along with hip abduction, the TFL that is, that if it is tight, it will result in an abnormal internal rotation of that knee. So we can take a look at this. A little counterintuitive because you think of the gluteal muscles as being in this posterior side. How could they possibly promote internal rotation? Wouldn't it always be external rotation? But if we really take a look at where they're located, if I hide this, we can see that based on where they attach on this femur, on the greater trochanter of the femur, it makes a little bit more sense of why it acts as an internal rotator and not necessarily an external rotator. Okay. The pectineus, of course, it's in a prime position to do this as well. It's just not as powerful as these deep gluteal muscles, the medius and then the minimus underneath it. And those are the muscles of the hip.